Doctors are the backbone of any healthcare system, but in India, our doctors are struggling under a crisis that is pushing them to the edge. They are underpaid, overworked, attacked in hospitals, and leaving the country in large numbers. In this video, we'll uncover the reality of Indian doctors through data, stories, and hard truths, and see why the very people who save lives are themselves fighting for survival. But the story begins with something most people don't realize: how little doctors in India actually earn compared to their counterparts abroad. A fresh MBBS graduate in India earns between 40,000 to 70,000 per month in private hospitals and 60,000 to 80,000 in government hospitals. That's only 4 to 8 lakhs annually. And even experienced specialists after years of training make 10 to 30 lakhs a year only. Now let's compare this with the developed world. In the UK, that same doctor can earn up to 50 lakhs to 1 crore, and in the US the number goes up to 3 to 4 crores. Same degree, same years of hard work, but drastically different rewards. And if the pay gap wasn't shocking enough, the cost of becoming a doctor in India adds another painful layer to the crisis. Medical education in India has become one of the most expensive career choices. Private medical colleges charge anywhere between 20 lakhs to 1 crore for an MBBS degree. Even government colleges, though cheaper, demand huge investment in coaching and preparation. Many students start their NEET preparation from as early as class 9. To afford this, families often take educational loans at high interest rates. The result, by the time they graduate, doctors are already burdened with debt and their salaries are nowhere near enough to repay it quickly. Imagine spending crores on education only to start earning less than a fresh IT graduate. And while money is one struggle, there's even more dangerous reality that doctors in India face every single day: violence inside hospitals. According to the Indian Medical Association, 75% of doctors in India experience violence during their careers. Government hospitals are the most dangerous, with 63.5% of cases happening there. The types of violence range between verbal abuse, which almost every doctor has faced, to physical attacks, with 93 major incidents reported in just 1 year. And here's the shocking truth: 70% of these attacks are not from patients but from their relatives. Poor infrastructure, overcrowded hospitals, unrealistic expectations, and negative media portrayals of doctors fuel this epidemic. For many doctors, stepping into a hospital feels like stepping into a battlefield. And this battlefield only gets tougher when we look at the working hours and conditions these doctors endure. Indian doctors, especially residents, often work 36 hours continuous shifts. This is despite official guidelines from 1992 that limit work to 12 hours a day and 48 hours a week. But the reality is 50% of doctors work more than 60 hours per week and 15% work more than 80 hours a week, and one of the 3 doctors gets less than an hour for personal time daily. This isn't just exploitation, it's unsafe for both doctors and their patients. Exhausted doctors are more likely to make mistakes, and mistakes in medicine can cost lives. According to the survey, 83% of doctors report mental or emotional fatigue. Among women doctors, that number rises to 87% compared to 77% for men. But the statistics on suicide are heartbreaking. Between 2018 and 2022, India recorded 122 medical student suicides and 1,270 dropouts. Most of these were doctors under 30, and nearly 60% of the suicide victims were women. In 63% of these cases, depression was cited as a cause, made worse by harassment, academic pressure, and systemic failures. Do you know India spends only 1.84% of its GDP on healthcare? The global average is 9.5, and even India's own target is 2.5 by 2025, which we are still far from achieving. Rural India faces the worst consequences: 80% shortage of specialist doctors and community health centers. Only 35 to 40% of the healthcare infrastructure is in the rural areas, even though 70% of India's population lives there. Nurse availability is just 1.7 per thousand people compared to the global standard of 3 to 4. By specialty, the shortages are shocking. Surgeons 83% short, physicians 82% short, pediatricians 80% short, gynecologists 74% short. For millions of rural Indians, getting a basic medical care is still a distant dream. Every year, 1 in 3 newly qualified doctors leaves India. Survey shows that 20 to 50% of Indian medical graduates want to work abroad, and about 2.5 to 5% especially target the United States. You wanna know why? Better pay, safer work environments, and advanced research opportunities and professional recognition abroad. They get everything that India struggles to provide. If India truly values its doctors, it must act now, because only when we protect those who heal us can we build a healthcare system that serves every Indian with dignity and care. I would love to know your thoughts in the comment section below, so feel free to start a discussion. And if you're a doctor watching this, I would love to host you in our podcast, so please drop your contact details below.